I'm Dennis Galucki. Welcome to the 597th Imagine Buffalo program and our 218th YouTube production hosted by our wonderful Buffalo and Erie County Public Library. Thanks for joining us today. This program is created by the Center for the Study of Art, Architecture, History, and Nature, and ImagineLifelongLearning.com. Now, before we get started, just a little housekeeping. Everyone watching will be muted and your video turned off. If you have a question or comment, please type it into the chat box and we'll go through them at the end of the presentation as time allows. We are recording this program, so you can watch it again later on the Central Library's Facebook page and YouTube channel. And please, we hope you share the link with others. Now, on to our featured speakers. Joining us today are Pastor George F. Nicholas and Ebony White from the Buffalo Center for Health Equity. Pastor Nicholas is the organization's CEO, and Ms. White is the Equity Impact Manager. Pastor Nicholas and Ms. White, please tell us a little bit of your background that leads up to your service to the community and your work. And I will tell you that I've titled this one of our two themes that we do on this program because I believe it fits perfectly. It's imagining a healthy, wealthy, and sustainable community. What would it look like? It strikes me that your organization is in that same direction. So kick us off. Tell us about yourselves and your work.
Okay, thank you. So, my name is Pastor George Nicholas, and I have the opportunity to serve as the CEO of the Buffalo Center for Health Equity and chair of the African American Health Equity Task Force. Prior to that, I'm a retired United Methodist pastor, and as a United Methodist pastor for 25 years. And I was really focused on urban ministry and really with an outward focus. Ebony, do you want to share a little bit about yourself?
My name is Ebony White, and I am the Equity Impact Manager at the Buffalo Center for Health Equity. I also serve as an executive pastor of a local church here in the city of Buffalo, but also I have over 20 years of community health and related engagement in our region, helping to ensure that community members know and understand that the landscape in which they live in plays a huge role in the outcomes in which they see in their life expectancy and the quality of their life. So we're just really glad to be with you all on this afternoon.
So let me just talk a little bit about health equity and the work that we do. One of the biggest indicators of a quality of life of any community is the health of that community. And so we started the Buffalo Center for Health Equity and to address the health disparities that exist in this region. We don't believe that your ethnicity, your income, your location should have anything to do with your health outcomes. However, the truth is that the social determinants of health, and I'll show you a thing about that in a minute, is what is the most significant driver of health outcomes for individuals. It's what happens outside of the healthcare system that really impacts your health. Nelson Mandela said these words. He said, "Health cannot be a question of income. It is a fundamental human right." And we believe that. We believe that your ability to live a whole, healthy, prosperous life is something that is really, to use biblical terms, God-given, but it is your right as a human being to be able to live a full, whole, and healthy life. Next slide. One of the people that really inspired our work is a guy named Dr. Paul Farmer. And Dr. Farmer was at the Harvard School of Medicine and was really dedicated his life to serving the lost and the least, those who had struggled. You see him, his pictures there. He had traveled to Africa to do some work in communities to help folks who were struggling with disease, and he ended up staying there, married a woman from there, and really had developed clinics and done a lot of things to really help people in this community. And he would say these words: the idea that some lives matters less is the root of all that's wrong with this world, right? So the reason why we have these health disparities and chronic diseases is is because of not of any God decisions, any divine decisions, but they're decisions that are made by human beings as they as they make decisions on who deserves access to resources and who does not. Next slide, please. The World Health Organization uh, says that the social determinants of health, what happens in our lived environment, is what impacts our health outcomes. And they would say these words: the right to the highest attainable standard of health implies a clear set of legal obligations on states. So the governing bodies have a legal obligation to really provide and build community to make sure that everyone can live a healthy and prosperous life. Implies a clear set of legal obligations on state to ensure appropriate conditions for the enjoyment of health for all people without discrimination, right? Next slide. And so here's our framework I want us to think about today in our work: the social determinants of health, the lived environment. This is what impacts health outcomes more so than human behavior. So let me kind of explain this a little bit. So often when you look at health disparities, and you'll see that for us, we focus a lot on the African American community, that you'll have higher rates of chronic diseases in African American communities. When I'm talking about things like hypertension, diabetes, heart disease, and many other diseases, asthma. And people will say, well, if people behaviors would change, if they would eat differently, or if they would do certain things, then these behaviors, I mean, these health outcomes would be impacted. And that's partially true. But you have to think about what are the things that operate in an environment that influence the behavior in the first place. And those are the things that we focus on, the social determinants of health. And the social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. So when you think about that, you look at the diagram, it says, is the education, healthcare access, economic stability, neighborhood and built environment, and social and community context. Those are the things, those things that are things that impact the health outcomes of individuals. So when you have disparities in any of those five areas, that will create uh, conditions that will produce poor health outcomes. Next slide, please. And here are some facts. These are facts, and these are facts that I wish that were not true, right? So I don't say these things because I'm trying to give rhetoric to make folks do anything. But you look at just three things right there: high blood pressure, diabetes, and stroke. And I see that we have some people in the medical world on our slides, right, on our call today. You'll see consistently higher rates of high blood pressure, diabetes, and stroke for African Americans, right? And some of them, some of those rates are significantly higher, especially as you move along the age continuum. And then when you think about it, African Americans are more likely to die at early ages from all causes, right? And when you see people in the who are presenting, often people will present with not only high blood pressure, but they'll present with high blood pressure and diabetes, or diabetes and heart disease, right? So oftentimes people present with multiple chronic diseases, which have a significant impact upon their life, quality of life, and life expectancy. Next slide. And so let's talk real quickly about history and think about how we have had four opportunities to impact these social environments. The first one was during Reconstruction, right? So we remember the time after the Civil War, and there was a time where during Reconstruction, there was some really good federal policy that really created opportunities for those who had been enslaved to live prosperous lives. And we'll see, and you will see, the data will show that in that short window of time of about 12 to 14 years, there was significant progress by in the African American community because there was legislative and governmental action that ensured the safety and the protection of all the people. But then when the federal troops were pulled out of the South, then you saw again the season of oppression that operated. Next slide. And then after the New Deal during the times of Roosevelt, there was again really good policy that was put in place that was allowing to help elevate people post depression and then through the Second World War. But even with those policies, we saw that there was racial actions that were taken, discriminatory actions and practices, and one of them being redlining, that it impacted the ability for African Americans to get fair, equitable, quality, affordable housing and living in safe and healthy neighborhoods. The third movement was during the Civil Rights era. So we saw the Civil Rights Bill of 1964, the Voting Rights Act, Civil Rights Acts of 64 and 68. Again, good policy, but yet there was not changes in the economic infrastructure of this country that would dramatically change the quality of life for the masses of African Americans. One of the things that we did see during this, after the 64 and 65 Civil Rights and Voting Rights Bill, was a great increase in the Black middle class and a great reduction in Black poverty during that time period. But then that kind of flattened out over time, and there's some significant problems that still existed. Dr. King would say there's nothing new about poverty. What is new, however, is that now we have the resources to get rid of it. So he said that in the 60s, saying that America had the opportunity and had the resources in order to elevate and bring people out of poverty and make a more equitable society, but we failed to really do that on a grand scale. And the fourth movement we have is now. I calling this the 2022 and above, the great opportunity of change. Opportunity to build cross-racial coalitions centered to end systemic racism. We saw the racial revolution pieces after Black Lives Matter, and then certain COVID-19 amplified and shined a light on many of the health disparities that existed, when we see that African Americans were more vulnerable to COVID-19. And in most American cities and in most American counties, African Americans were dying at rates of 2.5 to 3 times the population rate. Good news here in Buffalo, because of the work of our organization, the Buffalo Center for Health Equity, and some of our other partners, Erie County, through our COVID-19 response project, we have the data that shows that while the early fatalities related to COVID-19, there was about 33% of those deaths came out of the African American community, whereas we African Americans make about 12.6% of the county population. Through our COVID-19 response project, that was a robust community engagement, access to primary care, access to food, access to mental health services, access to information and education around COVID-19, we were able to lower that fatality rate down to 14%, which is right pretty much close to the population rate. And we were one of the few counties in America that were able to do that. Next slide. So where are we now? What is the ask? Well, the ask really is for this community, our region, to prioritize health equity, right? There is a moral argument to make for that. The moral argument is expressed through our actions. Gandhi said, action expresses priority. What have we learned? We've learned that resource investment in the context of priority and not availability. Let me give you two examples. In this region, when something is a priority, it happens. When you think about the AKG art gallery, that was something that people in community decided this is something that we want to do. This is something that will be good for our community, and the resources became available. The second example is this new stadium that the Buffalo Bills will be playing in next year. The community folks made a decision that this is something that's a priority. This is important. This is something that we're willing to invest in. And so a $2 billion stadium was constructed, and with almost $1 billion of public money, taxpayer money, to invest in a private business. So these were expressions of priorities of community. I'm not against those things, but what I'm saying is we must prioritize the health of our entire community, and those most vulnerable to chronic disease, because it's not only a moral argument, but it's also an economic argument. Deloitte, the accounting firm, did a study, and they came to the conclusion that if in fact in America we were to bring health equity, it would have a $2.3 trillion impact on our GDP, right? And so one of the biggest costs that we have here in America right now, that's really one of the greatest threats to our nation, is the high cost of healthcare. Yes, go ahead. Ebony, you want to jump in?
I just want to kind of share, I know we're running down on time, but when we talk about health equity, that's a lot to cover. And we understand all of the sectors of it. So I want to kind of give some focus to what the Buffalo Center for Health Equity in our scopes. Literacy, we understand we want all of our young people reading at grade level, which transcends through the spectrum in all of these scopes. Housing, we want to bring every one of our homes up to code. Our housing stock is over 100 years old. We want the people living in our community and living in our cities and neighborhoods to live in housing that is up to code. There is a lot of legislation and work that has been placed in our city government, but it has not been operated. It has not went into full implementation in regards to inspections and all of those things. Employment, improve employment status and opportunities to earn a living wage. It is not just about having a job, but indeed having a living wage that is sustainable for our average family size. Access to primary care, make sure every person is connected to primary care, coupled with insurance and appropriate insurance. Sometimes people have insurance, but they are underinsured, or they have insurance and don't know the appropriate door of healthcare access to go in. In healthy food access, providing affordable and accessible healthy food options. We live inside of a community that is saturated with what some would refer to as bodegas or corner stores. That is not offering to us what we need to be sustainable and healthy. Our collaboration work is what makes us extremely strong. The action of working with someone to produce something. Nothing that we produce is done outside of the partnership of our community leading our efforts and also finding all of the other sectors that are important to moving this work. We collaborate and we commit to the possibility of producing a greater outcome other than something that we can perform ourselves. If we can touch on average yearly 5,000 individuals, what is our capacity when we connect with other partnerships to expand our reach and our touch and our overall impact? In order to achieve health equity, it is mandatory that we work in sync with partners. Definitely, we have I will say, Pastor George has been critical in mitigating and bringing to the room those who may have opposition, but we find where there's the common thread that we want to improve outcomes for our community members. And many of us live in the communities in which we serve. We want to just also share what we've been able to do, a quick timeline, honoring your time is 12:59. I'm going to move quickly. The African American Health Equity Task Force developed in 2014. That started with a conversation of both faith leaders, academia, and also some business partners, and also healthcare that understood that there was something wrong. There was a lot of money invested, but we wasn't seeing a return of investment, which kicked off our Igniting Hope conference every year that brings speakers nationally and also locally. Our experts, we have experts very well at home that have had all sorts of strategies and ways that we can improve our outcome, but bringing them to the forefront and giving them space. Out of that work, from that task force down to where we are today at 2026, Buffalo Center for Health Equity was established. UB Community Research Institute was established in 2021, and also the Erie County Department for Health Equity was established in 2021. That is not just a local office. It does not go away. It is a part of our government. We understand that policy matters, our communities matter, and our not-for-profit sectors matter. And we have done that with that methodology of equity being centered in how we assure it, our assessment, and our policy development.
So we have, and we come up to your time. And so what I put in the chat, I think I only had Hannah's name, and I don't know if you go there. If you can go onto our website, Buffalo Center for Health Equity.org, Buffalo Center for Health Equity.org, and you will get more information about our work. Thank you. There's our website. Log on. We want to work in partnership and collaboration with all of you, so that we can build a community of care where everyone, final fun, not a fun fact, but a fact is that if you're African American and you live on the east side of Buffalo, you're going to live 10 to 12 less years than if you're white living outside of that community. That's not acceptable, and we can change that. Thank you so much. Back to you, Dennis.
Hey, Pastor George, Ebony, thank you very much. Since I've been doing this program, we've almost every year focused on wellness. The Robert Wood Johnson Foundation, as you know, puts out a county by county report, and I would always ask the question, how is it that Western New York's ranking is always at the lowest end of New York State's ranking? Forget the nation, just New York State itself. And I hear a lot of good people like yourselves pointing to the problems, identifying it. I think every year we're gaining access to more and more information, but we really are a country of zip codes, and those zip codes, as you point out, do determine an awful lot of people's longevity, their health, their education, their literally their health, wealth, and sustainability. So I'm glad you're doing what you're doing. My one question is, your offices are located in Canisius. There are good groups, again, talking about this, Medical University of Buffalo, the medical campus. What besides a conference and then having good people talking about it, how is it permeating the community, the whole community, or just certain sections that you might be focusing on? How does that happen?
Well, I mean, so if you go back to the one slide where you see that we've through our movement, we've birthed 3 organizations, right? One being the Buffalo Center for Health Equity, 2, UB Community Research Institute, 3, the Erie County Department of Health Equity. So each one of those entities are engaged in work and conversation around the issues of health equity. 3 of us come together and work on these issues together. We're constantly doing community engagement and outreach and creating a table. Our real mission here at the center is to create that table for collaboration, to create that space to bring people who understand how to address these issues. So, for example, in the Buffalo, only 17% of Black children are reading at grade level. 17%. Well, we can fix that, right? And because their reading impacts your employment opportunity, which impacts your economic opportunities, which impact your housing opportunities, which eventually will impact your health. So we just finished our Igniting Hope last session. We're going to be presenting a strategic plan around these 5 issues sometime in the early spring. And we're going to be inviting people from community to come and work with us on those 5 work areas that we're doing. So it's a work in progress, but it's a process, but we're engaging in that process.
Well, and I'm glad you are. Uh, Hannah or Melissa, whoever's looking at the questions, do we have any from the audience?
I do have a couple of questions that are coming in through the chat. One is the Buffalo Center for Health Equity involved in the project for replacing the Kensington Highway?
So we have been in support of conversations from the community around making sure that there is a strong impact study that will talk about the health outcomes and the impact on health outcomes of the project. It's our position that we're going to support the position of those who live in that community, and we will give them the information around health outcomes to help them make, not only make their argument, so everyone has the information about the health impact of this project. We already know there are high rates of asthma that are on a line in those areas around the 33 from carbon emissions. And so the 33 in itself has been, there's enough evidence to show that that has been a negative impact upon health outcomes in that community.
Thank you. I have another question, which you kind of spoke to a moment ago, but what is the best way for community organizations and individuals to help support this work?
Well, first, you can go onto our website, buffalohealthequity.org. And we want to engage in conversation. We're all about relationships, right? And so it's a lot of times people ask me, well, what one thing or 2 things can I do? And I don't know that unless we kind of connect and get in relationship with one another. So I understand what your areas of strength are. These issues are huge. There's a structural issues, but each individual has something they can offer, right? And so I think it begins with relationship building across sectors, across ethnicity, across class, that are people who are really interested in building this kind of, as King would talk about, the beloved community where there's equity for all citizens, regardless of income, race, sexuality, any of those things. We're all human. This is about humanity. We focus on the African American community because the African American community presents some data that is very, very alarming.
Thank you so much. If we have any other questions in the chat, please feel free to send them over.
Good.
Dennis, if you have anything.
Yeah, well, just the county is got a lot of resources to be helpful. How do you connect with Erie County itself that oversees the whole community of Erie County? How does that look from your end?
So we're one of the few counties in the United States of America that has embedded in county government, in the Department of Health, an office that specific mission is around health equity called the Erie County Department of Health Equity. They have produced some, if you go onto their website, they've produced some tremendous reports that document the inequalities plus recommendations that come directly from community citizens. We've helped them do over 2,000 interviews with Erie County residents about their lived conditions, their challenges, and what can be done in order to improve their living conditions. So the information and data is out there. The county has been a tremendous partner, and the fact that that office exists within county government by county law is significant. And we do a lot of work with the mental health department, all the different levels of county government. So they've been a really good partner.
And I'd like to imagine that your efforts helped create that unique department in some way, at least the awareness for the need. Is that an appropriate statement?
No, we did create it.
I didn't know how much credit to give you, but I figured we'd open that door for you.
Well, it's not about credit. I just want to make sure I'm just trying to tell the story.
And that's good. And that's why I wanted you on, Pastor George, to tell the story. And you did a great job, along with Ebony White, to do just that. It's an education. I said this program is sponsored by Imagine Lifelong Learning, because that's almost a necessity for any community to progress, I think, in the 21st century. It's just a never-ending process, and you're certainly got a vehicle that's part of that process. So thank you both for being with us today.
Inviting us. We'll come back
and log on to our website.
Thank
And
you.
if anybody's listening, if you want to connect one-on-one, please reach out. And I'd love to have a conversation with you.
Good. And we hope people take you up on that offer. So, folks, thank you for joining us today, and look forward to seeing you perhaps next week on the 20th on Zoom, where we will be joined by Dr. Catherine Grow-Ellen. She is she's leading the Heritage Engagement Project for the new Ralph Wilson Park that you've been hearing a lot about, and we will certainly get some good updates from Dr. Catherine Grow-Ellen. So, see you then. I'm Dennis Galucki. Be well and good day.